Good evening, friends. And today we are going to talk about crossing boundaries. As all of you know, crossing boundaries is an initiative by Dr. Vidyaa Smile Dental Clinic. And our understanding is to help our patients understand what you need to know about your oral health. And today's topic is very precious. So let's go ahead with the topic. And I'm going to start sharing my screen right away. So I hope all of you are able to see my screen. And so we are in the Crossing Boundaries session 2. And today's topic is going to be diabetes and its effect on oral health. So all of us understand that India is the diabetic capital of the world. And this is the bitter truth. In 2015, there was a prediction that 69 million people will be diabetic. And in 2040, it's around double the number at around 125 million. Now, if you look at the healthcare which has been spent on the diabetes management is also to about 90.32 pounds. So this is really so high. And if you look at how it is going to be in the kind of growth rate which was predicted in 1990, it is around 128% growth rate of diabetes between 1990 and 2013. Same way in men and women, if you see, there is a steep rise to more than 100%. So what is diabetes? Diabetes is a disease that occurs when your blood sugar, also called the blood glucose, is too high. And blood glucose is your main source of energy, which comes from the food you eat. And insulin, which is a hormone, which is made by the pancreas, helps glucose from the food get into your cells and which is used for your energy. So let's understand what are the common diabetes warning signs. So these are the people who would feel an increase in urination, and they'll have excessive thirst, they'll have blurred vision, increased hunger, unexplained weight loss, fatigue, dry mouth, irritable behavior, and wounds which don't heal quickly. And along with this, if you look at the patients, they would be having sometimes even nausea and vomiting. And this is very important. And they are more prone to infections. So this is not only physical infection, but even in terms of your oral infection. Type 2 diabetes is primarily the result of two interrelated problems. That is, cells in the muscle, fat, and the liver become resistant to insulin. And because these cells do not interact in a normal way with insulin, they don't take up enough sugar. The pancreas is unable to also produce enough insulin to manage the blood sugar levels. So if you look at the main symptoms, as I told you earlier, you have the central system, which is on your brain. You have a systemic where there is weight loss. Respiratory, you have problems. You have a kind of a smell or an acetone breath, as we call it. Your eyes become blurred. And gastric, you have this nausea, vomiting, and abdominal pain. And urinary, you have polyuria and glycosuria. So when we understand diabetes mellitus, we are talking about mainly, there is encephalopathy in the brain, diabetic retinopathy, which we're talking in terms of the eye, diabetic cardiomyopathy, and that is why we say diabetes is almost the precursor for a number of other diseases, especially heart. And then you have diabetic nephropathy, and you have the periodontal disease when it comes to the oral cavity. So although not everyone with type 2 diabetes is overweight and obese, but generally the inactive lifestyle are the most common causes of type 2 diabetes. So let's look at the cycle. Because you're having lack of exercise, there is obesity, then there is insulin resistance, there's loss of muscle wastage and loss of motivation to exercise because you're obese. And this just goes on as a vicious circle. Now, when your blood sugar gets really too high, that is known as hyperglycemia. Hyper means more. And the quickest way to reduce is by taking fast action of insulin. So when you give insulin, it becomes a fast-acting insulin. So it tries to balance the blood sugar. Exercise is another fast, effective way to reduce the blood sugar. And you have to eat consistent diet, which could be based with whole grains, fruits, vegetables, and lean proteins. Now, it is better to have a sugar monitor, and you can monitor just before you start your exercise and probably just a little after your exercise, after you cool down. And your diabetic chart is supposed to be very important because you need to have a kind of a holistic diet, starting from the morning breakfast to the midday meal, to the lunch, to a snack or a fruit bowl, and then dinner. We need to understand that the total calorie should be around 1,600. Now, excessive amounts of added sugars have been associated with the risk of type 2 diabetes, which could be like, having negative effects on your liver and a high risk of obesity. And natural sugars, which are found in fruits and vegetables, are not linked with diabetes risk, whereas artificial sweeteners are. So what can you eat if it's good? It is natural sugars found in plants and are excellent for your body. Natural carbohydrates from fruits and plants, which is one of the best source of nutrition. And try to avoid refined sugars with the synthesized or it is artificial. And refined sugars and foods that are typically, which would give rise to high risk of food intake, especially for obesity, heart disease, and diabetes. So what foods are bad for diabetes? And let us understand that sugar-sweetened beverages, trans fats, white bread, rice, pasta, fruit-flavored yogurt, sweetened breakfast cereals, flavored coffee drinks, honey, agave nectar, and maple syrup, and dried fruits are not good. So here are the foods which, what you can eat and what you should avoid. So it is better you can eat a lot of virgin olive oil, berries, leafy green vegetables, spices. Cinnamon is very good if you add it. It also acts as a detox. And then you can have fatty fish and high protein diet. However, you should avoid alcohol, you should avoid gluten, you should avoid sugar, any kind of a dairy, fat dairy products, and then highly processed food or the fast foods, and any other unhealthy beverages, which is not very good for your body. So now let's come back to oral health, because diabetes and oral health go hand in hand. Most of the times we have seen that there is a link of diabetes with oral health, and this has caused a lot of gum infections, dry mouth, and oral infections. And this basically starts with the gum disease. And a good oral hygiene routine, regular visits to your dentist, and controlling your blood sugar will help you reduce the risk. So for a general patient, we say around once in 6 months is when you need to go to a dentist. But for diabetic patients, especially if you're not in control, it is better to visit your dentist once in 3 months. Now, what are the problems you could have because of diabetes? You could have tooth decay, periodontal diseases, bleeding gums, tooth sensitivity, recession of gums, bad breath halitosis, swollen gums, and salivary gland dysfunction. And when you look at oral health, as we told you, the gum disease is the most important place where infection of the mouth is there, and this ups your other problems, because once you have diabetes, your gum infection actually increases, and this high sugar levels also leads to diabetic complications, and it makes it very difficult for your body to fight against any kind of a disease, and this becomes like a cycle. So dental care and for people with diabetes, as I told you, try to visit your dentist at least once in 3 months, and keep your blood sugar in check. And very importantly, use a toothbrush with soft bristles, and visit your dentist regularly. And what are the 6 major problems you could face if you're a diabetic? So you could have excessive tooth decay, you could have taste impairment, delayed wound healing, gum disease, salivary gland dysfunction, and fungal infections. And today during the pandemic, I'm sure all of us are concerned with all these. Older people and those with underlying medical problems like cardiovascular problems, diabetes, respiratory problems, cancer are most likely to develop serious illnesses, and hence these are called as comorbidities. One goes and then these are people who are more prone to other problems. So what are the two main types of diseases? You have the dental caries, and this could be either on the top of the tooth or between two teeth. And then you could also have root caries, and then you have the gum infection. And these are certain diagrams just to give you an idea where the dental decay could take place. And now to understand perio, that is the gum disease along with caries, the connection, you will see that it is the major public health problem worldwide. And this happens because of untreated caries and periodontitis, and 1 in at least 3 people are affected by caries. And when you have dental caries, diabetes, and periodontitis, actually the severity becomes much more worse, and 10% of the global population are affected by severe periodontitis. And this could also lead to a tooth loss. Many a times patients come and tell us, like, the tooth just fell off, and they talk in terms of a pride that they didn't have to visit a dentist. But please understand, that means your bone levels have also gone down, and it is likely that more teeth could be falling off soon. So let's understand dental caries. We have 3 parts of the tooth. You have the innermost pulp, surrounding it is the dentine, and then you have the enamel on the outer surface of the crown. And in the root, we have the cementum. So when caries occurs, it can happen on the tooth, that is on the enamel, and that is the early caries. You will not have any pain here. You might have some sensitivity, and once this caries spreads into the dentine, you will have a little bit of sensitivity. Usually people avoid eating food on that side. They avoid eating anything hot, cold, or any kind of sweets which would trigger off this kind of a pain. And then you go ahead with what we call the pulpitis, wherein the decay has gone into the pulp, and that is inflammation of the pulp. So pulpitis means pulp is inflamed, and this will cause a sharp pain on the patient. And this is when the patient will understand that there is an issue. They might come to the dentist, and in this case, we might have to do a root canal procedure. But in the earlier 2 cases, just a mere filling would be sufficient. However, if the patient does not come at this stage, you will have the caries spreading to the end of the tooth, and that could lead to an abscess or a collection of pus, and this would be very painful. So the chronic periodontitis, which means chronic means for a longer period of time. So this could lead to any kind of a cardiovascular disease, diabetes, advanced, a pregnancy outcomes, especially when you look at pregnant women, if they have diabetes, along with that, if they have even periodontitis, then it becomes a problem in terms of either you could have a stillborn baby, or it could be, premature baby, or sometimes, there is an abortion also. So there is a lot of fear associated with this. You could also have some respiratory disease problems. You could have chronic kidney disease. You could have rheumatoid arthritis. Cognitive functions could be an impaired one, and then you could have obesity. Metabolic syndromes could be there, and of course cancer. So if you see, basically periodontitis, it works on all the areas. So what happens when we talk about a periodontal disease? So what is periodontal disease? It's nothing but a gum plus the surrounding bone infection. So here you can see in picture 1 that you have healthy tooth and gums, then you have a gingivitis, which means only the outer area of the gums are inflamed. Then in periodontitis, you have the gums and the bones are affected. So there is a loss of bone structure also. And in advanced periodontitis, the bone support has come so low that the tooth starts to move. It becomes a shaky tooth. Now, there are 5 stages of this gum disease, as I told you. You have from the healthy gums, gingivitis, periodontitis, advanced periodontitis, and tooth loss. And we need to know the reasons or the signs before it is too late. So that is why we said it is better to visit a dentist once in 3 months, especially if your diabetes is not controlled. Now, as I told you, diabetes and chronic periodontitis leads to a lot of other physical issues, and we just discussed about that. And if you look at all these, there are a lot of microorganisms which are present, and that makes it even worse. And if you look at the oral cavity, we say that the mouth is the gateway of the body. So whatever food you take, along with these microorganisms, if your teeth and gums are not not healthy, it would go into your body and it will start affecting the other organs also. So periodontitis and diabetes are both widespread conditions and among the world's population. So if you look at a correlation, as we know, India is the diabetic capital of the world, and we can see the prevalence rising. Similarly, if you look at periodontitis, there also the prevalence is rising. So we need to think about a lot of measures where we can control these factors. So when you look at the periodontal disease, you have a lot of bacteremia, which means a collection of bacteria, and this leads to an inflammatory response, and a lot of body reactions happens, and this gives you the immune response, and it starts affecting the various parts of your body. Now, major causes of tooth sensitivity, if you look at it, it will be around the neck of the tooth, and it will be because of sweet food, acidic foods, or any hot or cold foods and beverages. So what happens if the tooth is sensitive? You have small kind of tubules coming, as I told you before, from the dentine to the enamel, and you will have a flash of inflow or an outflow of the fluid within the dentinal tubule, and this would cause a kind of a sharp pain, and this sharp pain is felt by the teeth as a hypersensitive reaction. So we need to understand what are the other causes of tooth sensitivity. It could be because of tooth enamel erosion. Now, erosion happens when you actually start taking acidic fruit juices or anything very, very, detrimental to oral health. Now, this could also have something called, with hard toothbrushes and not using the proper method of brushing. And the other dental problems could be your gum, which is receded or which moves out, like you can see in this picture. You could have tooth decay. Fractured tooth can give you some kind of sensitivity. And if there is a filling and it has worn out, that also could give you sensitivity. And other general health issues could be acid reflux, what we call the GERD, and frequent vomiting, usually bulimia. That is, you would have seen many models who would want to voluntarily try to take out the saliva and the food after eating. So this is very important, and we need to understand some of these are temporary problems, and you can get it reversed when you visit the dentist. So that is why we want to catch them early. So these are some examples of the exposure of the dentine. Like you can see, the dentine is exposed into the oral cavity, and thereby it will start to be sensitive. And this dentine which is exposed will cause a lot of tooth sensitivity, and patients will not know that, and this could get worse if they have improper TM joint or the joint problem, which will make the crunching and the biting of the teeth, which will be more leading to this. So that is what we call abfraction. So that will happen between the teeth and the gums near the neck of the tooth. Another thing is the plaque deposit. Plaque is nothing but a white sticky substance which is seen on the surface of your teeth. And if you just rub your teeth with your fingernails, probably half an hour after you brush your teeth, you will feel the stickiness. And if you leave it like that, that is fine. But if you're not brushing your teeth twice daily, this will start attracting the food and the leftover food in your oral cavity, and it will start to harden, and then that becomes the calculus. And now once it becomes a calculus, along with the plaque, you will have halitosis or bad breath. So how do you test your halitosis? Take a hand in front of your mouth and just say, ha. Say it as forcefully as possible, so you will be able to smell your breath. Other causes could include dry mouth, any infections of the oral cavity, and if you have any tonsillitis or tonsil problems. So along with this bad breath, you could see some common causes. It could be any infection in the oral cavity, smoking, alcohol, coffee, bad hygiene, dry mouth, and diet. I'm sure for diet, you would know when you eat onions or even if you take some garlic, you will see some kind of a bad odor coming at that time. We have some peppermint or some kind of soap so that, you know, we will be able to mouth freshener so that we will be able to reduce or absolutely eliminate this bad odor. And this also, we have something called the morning breath. So once you get up in the morning, I'm sure all of us feel very uneasy. So first thing we do is brushing our teeth, because this morning breath could be really bad, and that is also halitosis. But mostly this halitosis would come down once you start brushing your teeth. Whenever you have dry mouth, that will also be there, and this happens due to stress also. And as I told you, you need to also floss between your teeth. So between the two teeth, you need to use a floss. If bacteria is stuck there, then also you will start having this kind of a bad mouth or a foul mouth. Next, when you think about diabetes, it is about slow healing wounds. And this we had told you, this could include any cuts or graces or blisters, which generally are not problematic. But then if you're a person with diabetes, it could also cause some infection. And in some rare cases, especially in the extremities, you would have seen people whose toes are cut or feet is cut because it undergoes something called gangrenous, which means there is no blood flow. So that is why we talk about neuropathy and diabetes. So we tell that you need to keep your extremities, your hands and legs without any cut. And this happens mostly when you have uncontrolled diabetes, because the blood circulation in those areas comes down, and it is very difficult for the blood to go and heal the area. So normal wound healing, where the blood acts and gives the kind of a cell respiration where the injuries heal fast. In a diabetic, there will be diabetic wound healing, which will be slow. So as I told you, we have 4 phases of the healing. From the bleeding, you will have inflammatory phase, and then you have the proliferating phase, and then there is remodeling phase. So in case of diabetes, what will happen is the inflammatory phase, the proliferative phase, both this are interrupted because of diabetes, and that is why the healing is actually delayed, or there is the repair is very slow. So in diabetes, as I told you, wound healing happens, which happens actually within hours, and then the inflammation comes, and then there is food cell migration, and then a remodeling, which takes about few weeks to months to heal. And when you are severely diabetic, you can see there are a lot of pathways which happens, and this gives rise to what we call as the slow wound healing. And all this just helps us explain that why we need to be very careful, especially we are diabetic. So it will also reduce the increase the numbness in that area, blood flow is repaired, and that is why the abnormal wound healing. Next, let's come to the salivary glands. We have 3 salivary glands. This is what gives you the saliva or the liquid in your mouth. It's more watery in nature. And you have the parotid gland, the sublingual, and the submandibular. So there are 3 major salivary glands and many minor salivary glands in your oral cavity. Now, when there is a salivary dysfunction, which means the flow of the saliva is either thickened, which means that, you know, it is not trying to cleanse your mouth, or there will be absolutely zero saliva or absolutely nil saliva. Then we call a condition called a dry mouth or xerostomia. Now, when you have xerostomia, you can understand, see, when the land is dry, there's no water, you will see a lot of cracks in the land. So similarly, on your tongue, you will see a lot of cracks, and this will be burning. It will be painful also for the patient. So for this, we generally say have a lot of citrus juices and lots of water so that you supplement the saliva. And why are we concerned about this? Because the saliva on the tongue, you have a lot of papillae, and these papillae are multiple in number. They are of different shapes and sizes also, and they are taste buds. So these taste zones are so very important because whatever food we eat, we need to know how it tastes, right? So let's look at the different types of tastes. We have the sour taste on the lateral side of the tongue. You have the salty, the sweet in the tip, the bitter at the back, and umami. Now, this common foods which could be sugary, sour, salty, bitter, we understand because we have, definitely looked into this. So what is umami? Umami is a neutral food like tomatoes, cheese, meat, fish, and dried mushrooms. So this is very important. So these areas which are demarcated on the tongue will stop functioning for a longer period of time if you are a chronic diabetes. So what is umami? As I told you, it is known as the fifth sense, and this subtle taste, and it blends well with any other taste. It does not have a original taste by itself. So the characteristics of the umami taste are tongue coating sensation, mouthfulness, long lasting, balanced taste, salivation, and complex. And these you can see it, you have it in the fish, that is sardine, you have in green peas, mushrooms, and cheese, and of course chicken, beef, tomato, onions, broccoli, green asparagus. So a lot of sources of umami there. And let us understand the tongue better. So you have the 5 basic tastes, and then you have, of course, spicy and astringent. Then you have the flavor, you have the palatability, and the food acceptability. So all these are the things which you will be able to feel with your tongue. And next, let us get to diabetes and unlikeliest infections. So you can have food infections, yeast infections, urinary tract infections, and surgical site infections. So when you come to the fungal infection, it is candidiasis, histoplasmosis, cryptococcosis, aspergillosis, mucormycosis, paracoccidomycosis, and blastomycosis. So I'm sure you would have heard this mucormycosis at least during the pandemic, which means it's a fungal infection. And we need to understand that the healthy tongue is mostly kind of pink in color. And if you have candidiasis, you will have it like a white color coated tongue or a whitish yellow coated tongue. So that means, there is a problem. And you would also have the same candida infection in your private parts too, which could lead to irritation, burning sensation, and painful micturition or painful urination. And oral candidiasis, if you look at it, I told you it will be like a white, kind of a creamy white bump on your tongue, cheeks, gums, tonsils. There could be burning or soreness. Usually happens when you have high fever and you have not taken care of yourself for a long period of time. And this could also have dried, cracked skin at the corners of the mouth, slight bleeding if the lesions are scraped, and a cottony feeling in your tongue with a loss of taste. During the pandemic of COVID-19, with relation to diabetes and oral health, we need to understand that COVID destroys the cells in the pancreas that produce insulin, and decrease in the insulin leads to the high glucose type 1 diabetic. So here what happened is during the COVID, people who got infected, who were not pre-diabetic before or had no history of diabetes before, because of giving the immunosuppressant drugs, they developed diabetes, and people who were already diabetic had a severe thing. So if you say mild, moderate, severe, so they had a severe form of COVID-19. So it is always better to try to take care of yourself, especially because of a poor innate immunity. And as I told you, diabetes becomes a crux. So when the crux is a problem and there are poor glycemic index, it's better to get a treatment for that. And let us see that, we try to follow all the precautions. And it is also one of the comorbidities, and you have an impaired immune and inflammatory response. So it is always better we take care of ourselves. And with the pandemic, as I told you, say 98.9% is a survival rate. So it's not that you have to be scared about it if you're diabetic, but nevertheless, we need to understand there is a death toll also for especially people who are poorly controlled blood sugar. And there has been a publication which is told that, studies have started to understand, help us understand the increased risk of having more severe COVID-19, especially quantifying the risk, which is very important. So this is very, important, because more studies are needed, as it is the pandemic itself is very new to all of us. So studies have started on the medical front to help us understand the correlations better. However, we need to start with a basic glycemic control of doing some form of exercise and monitoring our blood sugar level. And in case you are hospitalized, you need an insulin therapy. And if it is severe hospitalization, you might need even to monitor your fluid status. Hand hygiene is something which we need to follow, and avoid touching your face with bare hands until unless it's been washed recently. Social distancing and vaccination is also important. And we need to understand the comorbidities also, especially if you are obese, if you're aged, if you have obstructive sleep apnea or any other micro or macrovascular complications. So understanding the COVID-19 28-day hospital outcome, especially in diabetes, 50% got discharged from hospital, 20% passed away, 16% transferred to a different facility, and 12% remained hospitalized for a longer period of time. And this has also impaired a lot of people. So we need to understand, if you're obese, if you're there is inflammation, there is coagulation issues, there is hyperglycemia or diabetic, there is older age, hypertension, renal disease. This COVID has just made things worse, and that is why the poor outcome is there. So when we look at it, it is always better to be very, very careful, especially if you're falling into these comorbidities. So what is the advice for patients? First is take extra prescription for medication and supplies, and have a 90-day supplies delivered at your house so that you don't run out of your medication. And reduce carbohydrates, stay well hydrated, and monitor your blood sugar level often. And what are the warning signs of diabetes? If you have to look, as I told you earlier, you have a frequent urination, blurry vision, slow healing of wounds, extreme fatigue, not able to regain the weight loss, and this is very important to take into consideration. Now, mucormycosis after COVID-19, diabetes people are most vulnerable to that. And this is because I just gave you the information that because of the drugs used in the treatment. So we are giving you a drug just to take care of yourself, and after which you need to take care of your diabetic levels so that you can keep your health well. And this could start as any kind of a facial pain or headache, nasal or sinus congestion, and pain in the eye or loss of vision. And what are the steps to prevent mucormycosis? As I told you, keep your blood sugar at check, use steroids judiciously, use clean water in humidifier, maintain overall cleanliness around patients, and any mouth ulcers, please treat it immediately. And you can have a high protein diet. You can also measure your body temperature, keep yourself hydrated, follow all the medical treatment, and plan for weeks of quarantine, especially if you have come in contact with somebody. And all of us know November 14th is commemorated as the World Diabetic Day, and the entire month is helping people create awareness for diabetes. And here we have diabetes category and the management. So you have the stable diabetes, and then you have people who can just take tablets, and then you have well-controlled ones, and then you have some special conditions where diabetes are there in pregnancy, in adolescence, and complex type 2, and that is where you need a lot of specialist help. So what are the top 12 tips to prevent type 2 diabetes? Eat a well-balanced diet, include whole grains, reduce the risk of saturated trans fat, exercise regularly, limit the salt intake, eat fiber-rich foods, limit alcohol intake, give up smoking, get adequate sleep, avoid sugary foods and beverages, monitor your blood sugar levels, and check your feet for any cuts or bruises or blisters, because it's very important. What are the 7 steps for better living with diabetes? If you're already a diabetic, eat healthy, be active, monitor your blood sugar levels, take medications without any problems, problem. If you have anything, solve it. Reduce the risk, quit smoking, take care of your eye health, and cope well. Be very positive that you will overcome. Now, 1 in 5 cases of total tooth loss is linked to diabetes. So what are the few tips for our diabetic patients? Brush your teeth twice a day. Keep your healthy eating plan. Control your blood sugar levels. See a dentist if you have a red or a swollen tongue. So with that, we come to the end of today's presentation. I hope this was useful for all of you. So thank you, friends. I'm sure you would have got an insight into today's presentation. And take care, and we will look and we will definitely meet with you for the next session of Crossing Boundaries, session 3. Thank you so much.